So thank you guys, everybody, all our attendees for joining us today for Better Tech, Better Outcomes, how technology and collaboration can improve foster care, brought to you by Fostering Media Connections, Binti, and Opika. So up for discussion today, as the title suggests, are ways in which partnerships focused on improving the technological underpinnings of child welfare can help facilitate the kinds of improvements that can benefit kids and families. My name is John Kelly, and I am the co-executive director of Fostering Media Connections. Just a little bit about us, real quick. FMC uses the power of media and journalism to lead the conversation about children, youth, and families in America. And we do that through 3 different programs. We have the Imprint, which is a daily news site covering child welfare, youth justice, and youth homelessness across the country. We have Fostering Families Today, which is a bi-monthly magazine that goes right into the homes of foster and kinship caregivers all over this country. And our Youth Voice program, which ties into both of our publications, but more importantly, seeks to work with young people with lived experience, whether that's with child welfare systems, juvenile justice systems, who have experienced homelessness, to help elevate their voices directly, work with them on things like learning how to write op-eds or share their story personally, whether that's in print or on events. So that is a little bit about us. You can easily sign up to learn more about our great coverage, particularly in the Imprint, but everything else we're doing with our newsletters. Super easy. We have a weekly one if you really just want that kind of table of contents about everything we've just put up. Lighter touches for our region, Youth Voice, and Fostering Families Today. And you can just check that link there at the bottom, which I'm sure my colleague Sarah is also going to drop into the chat here. So we are joined today by some folks with all kinds of expertise around the topic at hand, represented on this panel, which I'm going to introduce you to shortly here, are former agency leaders, social workers, a young entrepreneur who experienced foster care, and a foster parent. So let's meet these guys. Here's who you're going to be hearing from today. Nina Powell is a consultant with Binti. She has worked in public adoption and foster care for 30 plus years. After retiring from Los Angeles County's Child Welfare Agency, she was Binti's 3rd customer when she was there. Veronica Davis, head of customer success for Binti, has worked in the fields of early childhood education and child welfare for over 15 years with a focus on raising the voices of both youth and families. Before joining Binti, Veronica worked for the state of Rhode Island's Child Welfare Agency, overseeing programs and services for the state's resource families. Justin Black, fellow Michigander, both here in Michigan, co-founder of Redefining Normal, a graduate of Western Michigan University and part of Forbes' Next 1,000 Entrepreneurs for 2021. Very cool. Justin and his wife, Alexis, have published an award-winning best-selling book entitled Redefining Normal, How 2 Foster Kids Beat the Odds and Discovered Healing, Happiness, and Love, while impacting over 15,000 families and communities with the Redefining Normal company, discussing healthy relationships, mental health, community growth, and healing. They also have a great podcast that you should download. Justin, you can push that yourself. Ken McGill, senior solution scientist for Opika, served almost 20 years within different capacities on a state level for a children's system of care. He is a clinical fellow, licensed marriage and family therapist, and he was the 2013 recipient of the Parade Foundation's Outcomes Champion Award. Kevin McDonald, last but not least, Vice President of Sales, has fostered for Opika, has fostered and adopted 2 children with special needs and heads up business development there at Opika. His personal mission is to help providers and other healthcare stakeholders make data-driven decisions, address sustainability, and provide patient-centered whole person healthcare. He loves working at Opika because they promote well-being for all. And as you can tell from the intros, and as I mentioned, the event that is being done here with FMC, Binti, and Opika, which are both represented well here on the panel. I want to give these guys a little bit of a chance to just sort of explain what they do. So Victoria, maybe you could start and just give everybody a little bit of an elevator speech about what Binti's all about.
Sure. Hi, everybody. Thanks so much for having us. Our founder, Felicia, started Binti because her sister adopted 2 children, and it was a really complicated process. It didn't make any sense why it was so hard, why it was such an antiquated paper-based system when social workers are working so hard every day and their work actually impacts children and families. So they needed something different. So born was Binti. We are a pioneer in the software space for child welfare, and we build tools to empower social workers and be able to connect all of their resources together, including their foster families, with a streamlined process for licensing, matching, and more. Currently, Binti is in 28 states, in nearly 200 agencies across the country, and we're serving 22% of child welfare nationwide with our software solutions.
Very cool. So Ken, tell us a little bit about Opeka before we get underway here.
Absolutely. Let me begin by thanking FMC for hosting this event and Binti for allowing Opeka to co-present. Opeka has developed a person-centered care model, keeping those we serve at the center, supporting whole person care, utilizing data in real time, capturing needs, as well as building strengths, promoting well-being for all. Our person-centered intelligence solution pieces actively supports systems collaboration. So often people are attached to different systems, but they don't connect with each other. They only work on certain parts of the person. So pieces can work either behind the scenes or up front with any electronic health record. The goal is to bring assessment information to life about that whole person. Opeka has built in a revolutionary success-focused artificial intelligence, which provides information about what works for whom, both on the individual and populations level. Moving from predicting risks should be the focus of everyone. And I know it's part of your work at FMC, and I know Binti has been doing this. Opeka's goal is aligned where we really are working towards successful outcomes and impacting health equity. So thank you.
Absolutely. Thanks, Ken. So here's what we're going to do. We're going to break this into a conversation today about three main subjects, all with an eye on how technology factors in. We're going to talk a little bit about COVID-19 and the new challenges that it creates for child welfare, or has created for child welfare, process improvement for agencies and social workers and foster families, and then another discussion about the empowerment of kids, families, and caregivers. Again, all with an eye towards how technology factors into all this. It's not going to solve all of it, but it can certainly play a role, right? And that's what we're gonna focus on today. Just some quick housekeeping before we get going with this. I'm just going to answer a couple of questions we always get. Is this going to be recorded and sent? 100%. If you attended, whether you're here now or you signed up but you're actually secretly watching college basketball instead, you're going to get it. You're going to get the video. But we especially give love to the people who joined us live. The other one is we definitely are going to do our best to have some time at the end for questions for these guys once they're done with this conversation. If you have a question or comment, please throw that into the chat, and me and Sarah will be keeping an eye on that and trying to pull together as many questions as we can. So with all that said, let's get into it, and we're going to start with the pandemic. So like most people in their own lives, right? I think the collective system of child welfare viewed this quickly as it was beginning as an emergency it was going to have to adjust to, hopefully for this short period of time. For certain, we know it was not a short period of time and it continues. But I think it's probably critical for systems to be thinking about this now, not as a problem that's going to end one day, but a situation that requires, a backup plan at the ready, alternative ways of working in unstable circumstances, and maybe some just new ways of doing things permanently. So let's all take a swing at this one here. Everyone share a major challenge you observed in your work, either early in COVID or an ongoing one. And since we have quite a robust panel today, I'll call people out so we're not talking over each other. So Nina, how about you start us off? What did you see happening?
Thank you so much, John. What we saw in Los Angeles County, which I suspect everyone experiences, the shock of, oh my gosh, we cannot have our in-person orientations to bring on new foster and adoptive parents. So we would always have 6 to 10 of those strategically throughout the county. And suddenly our offices were closed, our locations where we held the orientations were closed, and also the training sites for those people who did choose to become a resource parent. There was no training site available in person anymore. And then the other thing that we experienced was just simply those children already with caregivers in the panic of the situation and knowing that sometimes either the caregiver was sick or a member of their family or a foster child, and how do we communicate in real time and get information out?
Yeah, absolutely. Veronica, how about you?
I think for me, it was the loss of connection. It was early on in the pandemic when everything was a shock and we had to suspend in-person visitation with children and their families. And that was so heartbreaking because it was heartbreaking for everybody. It was also really tough for our resource families to be able to support children who were struggling with that loss so much, in addition to the families who weren't able to make those connections with their kids.
Yeah, 100%. I remember one of our most painful early stories and trying to get our heads around and cover the pandemic was just how many parents were on the path of reunification, right? And then all of a sudden they can't see their kids, and that's just such a painful thing all around. Justin, I don't know if I know anybody who's been to more child welfare conferences and events and things like since COVID started. You're out there on the road a lot. What are you hearing? What did you see happening as far as the impact of COVID on child welfare?
Yeah, of course. So one of the biggest things that I noticed just during the entire pandemic, so with the work we do workshops, trainings, and presentations with the parents, with the youth, and other stakeholders within the system, and with the youth themselves, specifically trying to interact with them, trying to communicate with them. Has been, as mentioned already, a huge disconnect. So as society has kind of adjusted to COVID, being more in person, being able to communicate with the youth, it's more, you can see ways that they communicate, their body language and other forms of communication that they have. So you're able to engage more and challenge them more and build more of a relationship. But as foster youth who already feel a disconnect, even if you're meeting with them in person sometimes, it's even more of a disconnect and an outlet to disassociate from creating a relationship while things are online and things are virtual. So it is hard to, in this space where we're trying to build relationships and encourage youth and help them with transitioning into adulthood, both personally and professionally, it's hard to really encourage them and challenge them and build that relationship on an online platform where it encourages disconnect more than it does connection and building relationship because of the different styles of communication with the body language and the verbal communication and other ways of building relationship just outside of seeing someone on the screen. So that's kind of what I saw has really had a huge impact during COVID.
Yeah, thanks, Justin, for that. So Kevin, you're involved in a company it's a relatively new company. You're building this thing during COVID, basically, right? So you had some pretty interesting, interactions, I'm sure, with some of these systems. Ken, you want to start? Just tell us what your guys' experience was working with systems.
Absolutely, and having served in a statewide system from 2 decades, coming over to Opeka during the pandemic, but also leaving the system of care while the pandemic was still continuing. The inequities that we've seen in terms of access to technologies, the redundancy of certain things in terms of the duplication of paperwork. For me, the biggest takeaway of this is that we need to recognize that there isn't an equitable, solution happening now, and we need to move forward. I had a discussion about the access to internet is almost like a utility, like gas and electric. Why are people left out? And if we really want to move towards making an impact on social determinants of health and wellness, and we need to have some really uncomfortable conversations. Uncomfortable for us because, again, we can't put our heads in the sand any longer. We must hit this full force, and that's where Opeka, starting up during the pandemic, was a perfect thing to happen.
Sure, Kevin, anything to add to that?
Yeah, if you could just share that one slide I have.
Absolutely.
Yep. Before I came to Opeka, I started in October. Formerly, I worked for an organization called the WIO, the Wisconsin Health Information Organization, which is an all-payer claims database. And I had the privilege of being able to look at data, from a global view on top and see what was happening. And one of the things we saw in the data was there was a seasonal lapse in Medicaid children receiving behavioral health services, and meant for mental health hospitalizations and also clinic visits. And so this disruption of service or lack of access to treatment and services, this was something that was really troubling and disruptive. But I guess the silver lining is that new technologies have come out, including what we do at Apika, to do things like whole person, real time outcomes monitoring, to understand who's crying out for help by conducting virtual check-ins to see who has needs, and just being able to keep in touch with people to understand when they're hurting and when they need our help. So like I said, that's what I saw. And I also, like Nina, I think the whole demand to help doing things online to help foster parents. When I was my last foster child, I went through training was about 8 years ago, and I remember wanting access to online tools for both training and all the forms I had to fill out, and it took a pandemic for the demand for those things to happen, but they did, and thankfully to Binti, the great work they do, we have those tools. So thank you.
Yeah, no, thank you guys. So let's wheel around. Kevin got to this a little bit just now, but we've discussed here a little already some of the challenges you guys saw emerge during COVID. Maybe we can wheel through everybody again. Same order. Let's start with Nina. What sort of technological solutions did you guys at Los Angeles or anywhere else that you've consulted with Binti, what started to emerge as solutions that helped us in the emergency situation, but also maybe in some cases are things we'll see stick in child welfare?
Yes, exactly. It was not, and you're right, John, it wasn't just in Los Angeles, it was these multitude of customers had the opportunity to really leverage the opportunity to work with Binti to engage our families in the midst of the pandemic in a different way. So for instance, with our previous orientations in person, we went, of course, 100% online. We have that possibility, we have that option available, but we were kind of in a hybrid model. Some people went in person, some people went online. Well, given the situation we were in, everybody went to online. However, it allowed for a personalized contact subsequent to the online engagement. So we had an outreach, and typically child welfare is divided in this, like an outreach and recruitment team. They're recruiting new people, they're engaging people, but they're not the people who are going to actually do the licensing, the family evaluation, go to the home. And so the outreach team really began to have follow-up discussions on an individual basis with those potential applicants or with applicants. And that was helpful because many people have been in an orientation where as soon as it ends, or training for that matter, as soon as it ends, there's a group of people who go because they have a very individual question that they didn't ask when there was a whole room of people, because they want to get their specific issue addressed. And this allowed for people to go onto the platform, do the required orientation, get the basic information, but then have that discussion about their individual situation so that they can decide, am I ready to move forward now? It's a decision. It empowers them to say, is this a good time in my life to engage in this application process? So they're not frustrated and they're ready, because we have found that people think about becoming a foster adoptive parent for a long time before they actually move into, yes, this is the best time for me to move forward. And sometimes the first engagement is not the last engagement. And this gives an opportunity for that to happen. We did the same thing with our training. It was in person. Kevin referenced it. Everyone had to go to the classroom. Everybody shifted. The curriculum was able to be adapted to a platform that allowed for the training information to happen in a very concise manner in a meeting such as this. And we still had the outcomes that we were seeking. And then the third thing I'll just mention briefly is that with our existing caregivers, it was so important that they had real-time information. And sometimes there were partners like an OPICA or anyone who would come to the department or to any child welfare agency with resources. And you could share it instantaneously almost with everybody, and they could read it at their convenience. And it's faster. So that kind of real-time communication made a huge difference for people. And especially Ken mentioned about the technology, that sometimes people were like, well, we got to get a tablet for the kids to do school. They need help because the schools were closed. It was just a lot of chaos, but we've been able to leverage that opportunity into something that is more sustainable.
Yeah. Veronica, does that resonate with you? Anything else, from the Binti side, stuff that you worked on or things that you guys were involved in with states?
Sure. When I talk about kind of that loss of connection, I think one of the things that we saw is that families were really open to pivot, to find other ways to break that cycle of cutting off that communication, right? Where visitation can be a really transactional process. So they started bringing FaceTime to bedtime. So it would all of a sudden be, instead of just this transactional 1 hour with a family, they were having opportunities to really be virtually, but with their child during their real day-to-day lives. And when I think about that from the Binti perspective, what we are really trying to do is connect all of the people who have to work with a child and a family, including the family of origin, resource family, and making those connections. And I think that this just catapulted us into a world where people can accept that that is a viable and helpful solution to have that connection together.
Great. Kevin, you discussed a little bit of kind of things that you guys innovated or thought of during this, but anything else from your guys' experience that kind of came up as a way to either, plug the dam or, that just kind of was born of COVID era, which continues today. And, you think states will embrace more long-term?
And you want to go ahead and take that?
But you can go if you want, because I'm just thinking about the grassroots efforts that many of our communities stepped up and did, and recognizing that we as people that have the hold of technology. I know Justin, the ROSE program, that in terms of rising over societal expectations and moving forward, if we just looked around even our communities and within our lives and what they're doing, it inspires, and that's where I think Dr. Kay Cordell, who co-founded OPICA, put the rubber to the floor and moved forward. What I was thinking.
Yeah, Justin, thoughts?
You're on mute.
We lose him?
Is on mute?
Oh, sorry about that. So one of the biggest adjustments that I've seen that a lot of our company as well as others have needed to make, and what has been beneficial, is multiple forms of communication. So not just one interaction as was mentioned, but multiple ways of communicating. So you do have of course, maybe Zoom call, but then you can send out forms or different things before and after, just so youth can freely write what is going on in their current situation. As mentioned, they can update the information that they currently have in there, and they can continue to go back and forth as opposed to having one simple interaction. What we've done is sent out forms to gather information to adjust our workshops and presentations for youth. So as we go into the presentation, we can deliver information and content that is relevant to them and informational for them, so they can progress forward in some of the things they're going through. So it's been multiple ways of sending information before we interact, delivering more information after we interact, and continuing that interaction throughout the day, throughout the week, throughout the month, not just simply one presentation or one interaction. So that's been hugely beneficial that I found with technology, and something that we can probably improve on and take advantage of and create more platforms to do. Just communicate, provide questions in different forms and different links that to send to youth, and really encourage them to communicate through those methods.
Thanks, Justin. And, I want to just call out two comments we got in the chat about what we're talking about here, which is barriers that came up in child welfare during the pandemic, which continues. Tiffany Thompson wrote, transitioning to telehealth therapy was a challenge and continues to be so. Thomas Dillingham wrote in that the major challenge they had was foster parents that didn't want to accept children into their home unless they were vaccinated. So two pretty big issues. We certainly heard that quite a bit at the imprint. I'm going to throw that out to all of you guys and say, you know, on either one of those, do you feel like improved tech solutions could play a role with those issues? What does anybody want to jump in and say about that?
I mean, I'll just kind of follow up if that's okay. So yeah, I mean, I've seen that example a lot of times. Like soon as the pandemic happened, I've seen a bunch of different youth kicked out of their residential home, and the trust and relationship between the youth and who they're living with or other adults in the situation really there's a disconnect. So some of the things that we can do is try to work to provide like the online COVID testing, and one of the things that is really been provided and recently, just the online COVID testing from local governments, from different people, for you to take those tests, get those immediate results. So there is transparency and there is good communication on both ends. But just as much as possible, just have good communication as far as transparency around what's going on and how we can get that information as soon as possible, I think will be huge.
Let me jump in too, John. I'd like to give a shout out to one of our customers, FaithBridge. I think the technology, the innovation, the outside of the box thinking that they brought to our industry or to our families and communities of really getting communities and churches specifically involved in foster care and finding new foster parents. So really being inventive on, how do we get more people involved? How do we open up the minds and the hearts of people to love and serve these children that need a forever family or even a temporary one? I think, just thinking outside the box with all these challenges, as you mentioned about vaccines and COVID, I think a lot of great things happened, and those things are going to continue to bless us for years to come.
Absolutely.
Can I quickly say, make sure that we're hoping that it doesn't go back to where it once was. So telehealth, just to get that word out, is usually signed as a temporary order. So be as proactive as we can to make sure we get a hold of our legislators to make sure these stay permanent. I'm just so fearful that we're going to go back to the way things were. And that'll be sad.
Yeah, I think the key thing there, right, Nina, maybe is to figure out a way for that to have a permanent role, but in the interest of the client, right? Like there's some people are, I certainly have family who didn't like it, or some people who felt like, oh, this is much better. They're meeting me where I'm at, literally where I'm at. So that's going to be key, right?
Right.
Oh, I'm sorry, John. I just wanted to add that it's sort of like breaking down the silos as well around the healthcare profession and the child welfare profession, and people having accurate information. And there were, we were able to do some webinars, answer questions from caregivers directly, and really have an opportunity to communicate with them with some, medical professionals, so that there's like that transparency and the information from people who have the expertise.
Yeah, no, thanks for bringing that up. All right, so we moved from COVID. I see, so we still got some comments in there, and I think we can get back to them hopefully, and if we have some time for questions and stuff. But that was great. Thank you guys for sharing kind of what you saw on the ground as this is all happening. Let's move to process improvement. Right? Sounds not that sexy, a little bit boring and wonky as tech can be, but so important. And I think we didn't really discuss it in the context of COVID, but this is a field that at its best times has some serious challenges with workforce and turnover. And at this particular time, we're really struggling with it in a lot of different places. So the extent to which you can make your process, the way that the job feels for people who are working with these families, foster families with caregivers with kids, it's so much more important now, I feel like. So I'm going to go to Veronica first. Can you kind of from the Binti perspective, from your experience with Rhode Island, talk a little bit about what you've seen in terms of innovative strategies that have emerged for improving that process aspect of the work behind child welfare?
Oh, I love that question. And I think it is a sexy topic. I love process. It makes all of our lives easier. So I think ultimately innovation sounds really scary and sometimes unattainable. It sounds really big. And while it can absolutely be implementing software, data systems, innovation just means change and transformation. So making the switch to technology can be challenging, but there are a lot of things that organizations can do now that prepare them with future efforts in technology and improve their data health now. So what I really recommend to folks is kind of flip the script a little bit, look at your process from a different lens. And so for every requirement in your process, no matter what your organization is, you ask, what is the value add that I'm getting? And if there is not a value, if it does not support children, families, an absolute law legal requirement, can you remove that part from your requirements? And a great example that's come up is if you look at documentation you send out to families, there are often multiple forms that have lots of duplication on them. Can you remove questions off the form? So you're still getting it, you're just not having people duplicate it. Then what I would say is apply the same process for how you accomplish your work. So many organizations have systems where their processes are very linear, one step at a time. But by allowing a system that can be, you can do many things at once, you increase your opportunity to actually be responsive to families and their needs, which improves their engagement, which improves their satisfaction. Like you have lots of downstream effects. Through everything I just said, there are lots of pain points that'll get identified. Listen to your families. If that is the simplest innovation that I can suggest, hear your families and what they're saying, how they experience the system, and it has to inform your transformation. So what I find is that over time, organizations really struggle because processes evolve, but not always thoughtfully. They get built around a person and then that person leaves, or there's a change in requirement from a stakeholder, some unfunded mandate. So when you go through the process to clean your system with this value add lens, you get buy-in from your team, your stakeholders. You have to bring people as part of that process. So know what you're doing, why you're doing it, document, create the playbook, because then that becomes like your solid foundation. So whatever system you apply it to, you're ready to go and everyone has the same expectations. So those are really small changes that don't sound like innovation, but they are, because you're getting yourself prepared for kind of this higher level of technology. And ultimately, when you can say, I know what we're doing, I know why we're doing it, and I know it supports children and families, you can feel good that you're not using your time ineffectively. You can really reinvest in the relationships you have with folks you're serving.
Thank you. Ken, from the Opeka perspective, like what have you guys seen emerge as, innovative strategies on the process?
Absolutely. Veronica, I agree 100%. This is one of those topics that is absolutely incredibly sexy, dynamic, and you're a tough act to follow.
Okay. Process. that could be the hashtag process.
While you were speaking, I thought of Wraparound. Serving a statewide system of care, we had folks from the Wraparound coach us through this whole process when I was a clinical director for a care management organization. And I remember Bernicia Fields was her name, and she said all the time, process leads, paperwork will follow. How you defined it is beautiful, because we need to look at the processes and make sure there's no duplication. And the one thing I think we found, and I know I've seen it throughout my 2 decades, is that children, youth, and families have to repeat their story. So wouldn't it be great if that information follows them, so that we know as much as we do about that person, so they don't have to retell, and we're engaging more in that process. So Binti's amazing case management software, and how innovative and how incredibly dynamic it is, and with Opeka's person-centered intelligence solution in partnering, bringing it all together. I'm going to put a blog in the chat, because again, before COVID, I probably couldn't even spell blog, but in terms of some of the things about blogs, podcasts, we need to catch up with the use of technology, embrace it. But I remember it takes a village, and there's so much siloed, like Nina was saying, and many times information gets siloed. And if we collaborate as much as we can really solve so many of the inequities that have been really part of our institution. We don't need to do that any longer. So that's what I just think is so important.
No, well said. I want to ask both of you, feel free to jump in on this. Veronica, you discussed the need to kind of hear families and incorporate what they're telling you into, which I would agree. It's sadly there's some systems out there that would be innovative for. I'm wondering, but like you have that experience, both of you, Veronica and Ken, from working in an agency and working in government. Now that you're both involved, on the corporate side, right, and providing these tech solutions, how does Binti and how does Apika get their own direct kind of feedback loop going with families and kids? How do you guys go about that?
That is an awesome question.
It really is.
On the Binti side, we have such a strong and kind of deep relationship with our customers that goes beyond like what's happening with their account, right? We want to know what the health of their agency is and what we can do to support and what Binti should be doing going forward to support those agencies. We actually just recently did a training for foster parents in one of our jurisdictions so they could be more familiar with Binti. We have live folks on our chat. They're real people that are answering, and families are coming in constantly and they're getting feedback and we're hearing what their experience is. And sometimes they're getting on the phone and it's grandma who, and I did notice a comment about, some of our maybe more mature providers who maybe aren't as tech savvy and don't feel as comfortable. So we get to have that direct connection with them and with their support system within those agencies. And that has absolutely informed so many of the features that we put in Binti, because we know that they have to be used by those folks. So it's really been fabulous to have that insight.
Absolutely. And I would just add that unfortunate part of Opeka to always keep in mind putting the person at the center. And having met Justin and his wife Alexis in terms of how lived experience and the input of creating something, the statewide system of care that I came from was actually written by parents, written by those who've been through the system. And to have a 2-decade-old statewide system that shows success goes right back to how it was structured and making sure that voices are heard, listened to, and empowered. So that's what I would add.
John, do you mind if I add into that?
Of course, yeah, go ahead, Kevin.
So one thing I think that we do at Opeka that's really brilliant is that part of that consumer, that child in care, part of their story map is all about their preferences, about what works for them and what what do they want to see in their own care. And also we capture their goals, their personal goals, and what are they trying to achieve? Are they trying to reunite with families? Are they trying to obtain a GED? Are they trying to get a handle on their anxiety maybe? So we're putting the person at the center and actually getting input right from them, that the behavioral health professionals or whomever can have that information, so that it's all about them and having them achieve well-being and resilience.
Absolutely. And I see Miguel in the chat trying to make hashtag processes sexy a thing. We love it. We're here for it. All right. Third topic. We move from process to empowerment. And Justin, I want to start with you. The question, to me is, how do we build systems that, empower children, families, and caregivers, and is kind of rooted in success, and actually gauging the success of people? What do you think, and how does tech play a role there?
Yeah, so one of the things that I always highlight is first, when it comes to specifically the youth themselves, the youth and those that are also transitioning out, is how are we evaluating the youth and the input that they have in those form of evaluations. And one of the amazing things that I've been able to highlight and talk about a lot is the NEKC's Foundation's 7 life domains, and being able to break that down and how unique and dynamic we are in all of these different categories and not just one set. So once we're able to kind of identify that, and once we are able to maybe implement that idea of the 7 life domains into some of the processes that we have, into some of the online resources that we have, youth and families are able to identify, okay, so the children in my household are struggling either in education, they're struggling in this area and that area, and I'm able to communicate that on a certain platform, and also seek out resources and help once I'm able to identify that through a certain platform. So being as a conduit of information in the network to connect the issues to some of the solutions through online platforms and resources, I think would be a great opportunity. But it starts with being able to see ourselves as unique individuals, see families as unique with multiple different areas and categories where they can receive support, and they can also identify those issues and get the help and resources that they need for that.
Yeah, absolutely. Nina, what do you think? How does tech play into empowering kids and families and caregivers in this system?
Well, I kind of see tech in, everyone said some really great things already, but it's how can we be as transparent as possible? And technology gives us a platform to share information that everyone can see. And sometimes, we work in the past, and I liked your question about shifting from, government to the private sector. And it reminds me of how I would always say in my career and along the way that you can work in a bureaucracy without being bureaucratic. And it seems like an oxymoron. Like, how do you do that? But when we use language like we're all part of the same team, like the NCAA is going on as we speak, right? That when they're playing the team sport, if everyone is really equal and important to the team, that's how you win the game. And so whether you're the youth or child, the birth parent, the social workers, everyone engaged around that family is critical to the team reaching the goal line. And so we have to be clear about sharing information, communicating timely, and recognizing that technology gives us that opportunity to ensure that there really is transparency. And sometimes we have to rebuild trust. I love what Veronica said about value added. And we have to sometimes say, in the past, it wasn't a great experience maybe for Kevin, but he still got involved and is helping us be better. John, your experience, getting involved and helping us be better so that we're on this wheel. That's why I love the wheel. It's evolving, it's constantly evolving, but improving. So technology gives us that way of improving because we all want to get to the same goal. But we recognize the bureaucracy needs a lot of help. Absolutely. And we're not blaming.
Got it. Kevin, I know you have a visual aid to talk through this stuff, so I'm going to just pull that up while you start talking about empowerment from your perspective there.
Sure. Well, in addition, at Opeka, we believe in person-centered care, and that's why we have our technology called person-centered intelligence solution. And we believe in taking care of the whole person. But another concept that's really deeply part of our organization, embedded in our technology, from the vision that our co-founder, Dr. Kate Cordell, had, is all around predicting success instead of risk. When you predict risk, you're identifying who's at risk, but when you predict success, you're figuring out how you can lower risk. And then when you predict risk, you're applying a category to the problem, but when you predict success, you're applying actions to the problem. How can you make it better? And then also when we predict risk, we're generating labels, which isn't healthy. But when you predict success, you're generating results. And that's what really matters, is helping people get better, achieving well-being, achieving resilience, and being the best person they can be. When we predict risk, it's often negative. Think about that. Think about how we predict someone's likelihood to go to the emergency room or readmit or relapse. They're predicting things that are negative, right? Well, when we predict success, we're being positive. Everything is positive, and that's what children need. They need us to be positive for them, in behalf of them. And then when we predict risk, we're promoting stigma, and that's not healthy at all. We need to make stigma extinct. We need to get rid of it, and we don't even need any of it. But when you predict success, you're promoting support. And that's not what only the children in foster care need. That's what those foster families really need. They need that support. They need that ability to predict what's going to be successful for them, so they can even have the hope to maybe become a foster parent, but then also so we can help them figure out how to get respite care at the right time for their family and for the good of their child, so that they achieve victory in their foster parenting and adoption. Maybe.
Do we have a success assessment in the child welfare bill? Yeah, you read a lot about predictive risk stuff, right? Risk assessments. Everybody's got one that they do. Do we have one yet? Are you guys inventing one? What's going to happen there? That's for anybody, by the way.
Well, I know there's always been, not always, but there have been models that we've used around assessing the family, but it was the family strengths and their needs.
Yeah.
And that's a little different, but it still is sort of, how do we build on strengths, which was how we did things like team decision-making or child and family teams, and just supposedly looking at the strength of all the partners.
Yeah, that makes sense. All right. So good.
Just real quick, I wanted to also add to that, just based on interacting with youth and also using part of my life as an example. So some of the success components that we can start to identify and include is beyond just the family. What are the other resources that are available within the community? Are there maybe church resources or other resources available? Do the youth have access to a coach or a mentor or someone who can help them along their pathway, and family resources that can support them, like a church or other organization? So assessing what's around the family can a lot of times, I feel, contribute to if they're successful or not, and if youth are making a successful transition.
Yeah. Can I just add one quick thing, which is sometimes just breaking down some of the myths or fears that one of the programs that I was involved in Los Angeles was, and it's a parent partner program where it's birth parents whose children were removed, and they work with other parents now to help them basically engage in getting their children back. And there was a lot of fear sometimes between the birth parents and the caregivers around safety and just partnering, and also obviously with the system social workers sometime, and just having those kind of opportunities for panel engagement help to eliminate some of the concerns that would basically ultimately support visitation and reunification. For some people, reunification works, and sometimes there is that long-term foster adoption that happens.
Mm-hmm.
Great, guys. So we have time here, I think, for at least a few questions. I'm going to rip through them and just volleyball style. I'm spiking them up. You get whoever wants to take it. Miguel asked two, so I'll ask them both at once. And anybody who wants to weigh in, go ahead. What is currently being done to eliminate all the red tape between agencies? That's really interesting. I think Ken and Kevin, you probably have some thoughts on that, since you that's a kind of Opika's niche, right? Is to kind of pierce those silos. And then, can blockchain be utilized to provide a more secure transfer of information? Wow, good stuff. Anybody, what do you think?
I'll just take a great resource to look in terms of finding direction is the imprint. So in terms of really getting a set, and I'm not just saying that, I think in terms of what you've accomplished in so many decades, is to make sure that we have a full understanding of what needs to be accomplished. So often we get that little bit of information, which can be really dangerous to try to solve something. So getting a larger picture and to work together in a collaborative way. So if you haven't already done so, I know I've signed up to receive. It's really essential, because the red tape I think has been created for safety purposes. But if we can be proactive and keep everyone safe, like Kevin was saying, risk assessment, is certainly something we should start with, but not end with.
Yep,
Yeah.
absolutely. Anybody
Yeah.
want to take that blockchain question on? Kevin, if you want to go first or something else, I love that.
I'll add to the blockchain. I'm actually a blockchain kind of geek, but I think definitely there's a role for blockchain and transferring this sensitive information. And I think what's going to happen is kind of in the fintech world, the financial world, I think blockchain is really going to blow wide open there. And I think that industries or providers, foster providers and child welfare, I think we're definitely going to find a way to share information between providers and between families and state agencies, sensitive information quickly, rapidly, to finalize proceedings. There's going to be all kinds of different applications to use that. So I'm really excited. I think it's going to go a little slower than maybe we might want it to.
Yeah, but I do agree there's some potential there. I'm going to just quick shameless plug. We have a weekly podcast, and the guest for the one going up this Monday is actually a former foster youth, is a digital artist, and he sells his work through using NFTs. So the conversation is about his experience with art, right? But he got to some really interesting stuff at the end. His name's Carl Wyatt, by the way, on how that whole thing could be used to kind of help us make sure that, foster youth, particularly older ones who may be facing a transition into adulthood from the system, have access to knowing what they're eligible for, knowing what they can avail themselves of, right? So just a quick aside. Anybody else want to take on blockchain or red tape before I get to the next question?
Take on red tape.
Go for it.
So I think we see, for folks who might work in state systems, I think we see a lot of cross-line communication in systems like ICPC for folks who use the NICE system. And we're using technology to make those connections, but arguably it still can be pretty clunky. So I think what I would say to anyone working in a statewide system on this call is to really encourage you to have conversations when you were looking at upgrading your systems, SACWIS to CWIS, that you are thinking about all of the ways that you collect and gather information and how you allow it to be accessed from stakeholders, particularly your legal, CASA, family courts, bio families, all of that. If you are in a private organization who is serving a larger child welfare organization, raise your hand and say, I want to be part of that process with you. You have to provide that community perspective because it's a very different organizational structure and you have such a different lens that's so important that we wouldn't want to lose from the state side to know how you can benefit and collaborate better with that information. So raise your hand.
Yeah, Veronica, I wanted, just because there might be some folks that aren't hip to those acronyms you threw out there, and I think it's important, right? Because you're talking about a tech thing that people should be weighing in on that have nothing to do with like building it. So what is, just to brief, you don't have to go into like minutia here, but SACWIS versus CCWIS, and what is the difference and upside in moving that way? Just the quick version.
SACWIS is the old version of the federally mandated child welfare system, and there are a list of requirements that are quite long. CWIS is the comprehensive child welfare information system, and that is the new set of requirements for a more innovative, technologically sound child welfare system. There is an implementation period, there is federal money, there are lots of rules, there are lots of different pieces that go to it. And states are really looking to upgrade their SACWIS to CWIS transition to help support a mobile workforce, improved data migration, all of those different pieces. But it's a long process because they're very expensive systems that, we really at Binti as well, we talk to people about this all the time and really encourage people to look thoughtfully about what you're trying to accomplish. And it's really about the core of the support of your families that you're working with.
Catherine raises a good point here. I'd love for your guys' perspective on, which is we need to advocate for foster parents that it is safe to ask for help. Too often in the past, it's been proven to them to not be safe to advocate for help, which I think is obviously a huge challenge. And it strikes me as something that that technology can play a role in, right? So what have you guys seen, with your clients and partners around the country in terms of just improving that runway where there's not shame and there's actually a pretty easy way for these guys to get aligned to help when they need it? I'll call on Nina since you look ready to go.
Well, one of the things we've seen is just an ability to engage the caregivers as paraprofessionals. Easier said than done, but the concept of how do you have a platform or a way of networking between, with their permission, of course, to have some of the more seasoned, experienced caregivers be able to engage new caregivers or people who've been around or just need a little support with someone who's having a similar experience. And there used to be a lot more conferences for caregivers. They would meet each other. There was associations, and they had a way of connecting with each other. So sometimes it's because they feel like they're on an island with only the social worker for the child to connect with, versus having other people who are going through the exact same thing. And I think technology can play a role with their permission in sharing contact information and creating chat rooms and creating an opportunity for them to connect with each other. And we did the same thing, but part of it is also for the systems, and I use that very broad, to not to feel like someone asking for help means they're ready to have the child move.
Yeah, so true. And I mean, I'm sure it sounds like from what you guys are talking about, like this is something that some agencies are thinking about and really trying to do in a dedicated way. I can say from our perspective, attached to Fostering Families Today, which is like a print magazine that we get out to caregivers, we have toolboxes like Facebook groups that we call like Foster Parent Toolbox, Kinship Group. And I think they speak very much to me, to the need that's being kind of enunciated here, because I do not go on them day in and day out, but when I am, it really strikes me all the time how people just need a place to voice what they're frustrated about, and know like nobody's watching this to like ding me as a caregiver. I'm just here to get advice, and it's important for all of us to have that kind of safe space. So we are at I think they got like time for one more for you guys, unless did anybody else have a thought they wanted to share on that last question? If not, then I will I'll give you this one from Linda, who asked for you guys to talk more about how we can, I don't know if she meant this necessarily through tech or whatever, but how can we gear, the child welfare system development and reform, I guess, more towards parents and parent involvement. Any thoughts on that? It's a tough one, I know.
Ask them. Start
Yeah.
a conversation. I mean, that first step, be open to what they could say. Remove the bias, remove the filter, and start the conversation.
Yeah. Got to gather the voice of the potential foster families or parents. And you have to maybe try to shift from a system of compliance to a system of what's effective and what'll work.
Absolutely. All right, so we have come to the hour mark. I want to thank these guys for all joining us. This is a great panel, great discussion. We have an assessment, a quick survey that Sarah's going to post in the chat for folks. We always love feedback on our events. So if you have time, just quickly fill that out. I promise it's not very long. So again, from Fostering Connections and Binti and Opika and our panelists today, and Justin, I just want to thank you guys all for being here, and wish everybody a happy St. Patrick's Day, and have a wonderful end of your week. Thank you guys.
Thank you.
Thank you. Thank you.
Take care, everybody.
Take care.
Yeah.